Hi, this is Dr. Thomas Funcik, and this is hopefully the first of a series of videos, and the purpose of this is to try to give you some straight up information about some of the newer things that are available for facial rejuvenation. You know, there's a lot of good information, a lot of not so good information on the internet, and I'll promise to always give you the straight scoop. This first topic is on Sculptra. You probably haven't heard as much about Sculptra as some of the other products like Botox, Restylane, because they have not done a lot of direct-to-consumer advertising. But it's an important part of my practice. It's a great, long-lasting agent that helps pretty much any patient from age 40 or so on up, and it makes my surgery, my facelifts, my eyelids turn out better. It's a volumizer. It's a collagen stimulator. What it really is just water with little corn sugar crystals. Those corn sugar crystals go away like any sugar, but over a period of 2 to 3 months, it builds up your own native collagen that's been lost. I mean, if you think about it, a 5th grader has a nice full face, a cheerleader still has volume, but then when a woman enters her 40s, especially if she tries to stay in shape and loses volume, she develops valleys, bellies in the tear trough, the temple, the cheek. Normally, the facial bones are covered by a smooth envelope of skin, but or a smooth envelope of soft tissue. But as we age, those prominences, those bony prominences, start to show. So I'd like to take you through a patient now and show you kind of what we did for her, what Sculptra achieved for her. This is an example of a patient who presented with valleys. Very attractive, but a lot of volume loss in her temples, tear trough, cheeks, etc. Here she is with preparation for marking as to where the Sculptra would be placed, delineating the valleys. Here she is about 3 months. Sculptra's begun to proliferate. You can see the valleys in her temples, tear troughs are filled, and there's an overall smoothness to her face. And here, just to show off a bit, is how makeup, which would normally accentuate potentially peaks and valleys, makes her face look beautiful, youthful, more healthy. So, in other words, we went from a status of having a lean but attractive looking face to having a full, youthful, healthy appearing face with no surgery. Okay, as you can see, those results were pretty fantastic. I picked her as the first patient because I wanted to show what the results of Sculptra could be if in a patient who had no surgery. Now, if you combine Sculptra with eyelid surgery, with facelift, etc., you can get a much better result in terms of a smoother eyelid. If someone's lost a lot of volume around their eyes and you merely remove the deep orbital fat, then they don't get as much improvement in the contour, they don't get as much improvement in the wrinkles as you can if you also restore the volume. People age 3 ways. They sag, they shrink, and they shrivel. If you're sagging, if your brow's hanging down and you got a parachute, you need surgery to lift that. If you're shriveling, you need either a chemical peel for all the lines, or you need Botox for the overpowered muscles, or you need Restylane or some other line filler for the specific lines. But if you're shrinking, or have some combination of those, if you can restore some of that volume gradually over time, then what happens is not only does the face look more youthful and fuller, but it can actually improve wrinkles somewhat in otherwise stubborn wrinkled patients. Now, it's extremely safe. It has a satisfaction rate that actually exceeds Botox in my practice. There's a learning curve. Sculptra is not getting as much widespread use because it takes really a couple years to learn. In order to do Sculptra, in order to administer Sculptra, you have to be previously certified in facial plastic surgery, dermatology, And then you have to be trained. Sculptra hires a physician who's experienced with Sculptra and spends a half a day with that doctor one-on-one, teaching them the nuances of Sculptra so that the results are good. It's a big commitment on the part of the company, on the part of the physicians involved, but it keeps the results of Sculptra outstanding. Check out our website, call our practice, ask for Lauren or Kim, and they'll be happy to give you more information on Sculptra. Thank you very much. Hope to see you again soon.